by Dentists in the Know. This is the webcast where dentistry meets real talk, real news, and just the right amount of sarcasm. We're pulling back the curtain on the industry. We are talking to experts, educators, innovators, and the everyday clinicians who are out there doing the work. There's no fluff, there's no filter, and definitely no sales pitches that are disguised as education. If it's happening in dentistry, from clinical insights to regulatory curveballs, or maybe it's the latest scandal at the ADA, we're probably already talking about it. And yes, we are bringing the goods. It doesn't matter if you're a seasoned doc or anyone in the dental industry for that matter. Maybe you're a curious consumer, or perhaps you're just here for the banner. We welcome you all to the show because around here, we're not just in the loop, we are in the know. Hey there, everyone. I'm Dr. Jeff Horowitz. Sadly missed you all last week, but I'm back and I'm accompanied by two amazing clinicians and two great friends, Dr. Jennifer Bell and Dr. Chad Duplantis. I'm just saying that our lenses might be complementary tonight. Just saying. We didn't plan this, but it happened. There it is. Anyway, we created this humble platform together, and we did that just to make the dental world somewhat smaller, but a whole lot more fun. And tonight we have a really cool topic. I'm just going to leave it like this. What do dentistry, ranching, and real estate have in common? Just going to let you all ponder that for a little while because we have a fantastic guest. Dr. Elizondo is with us here tonight, and he might be able to create the missing link as to how those three things go together: dentistry, ranching, and real estate. So I'm kind of excited about this one because I have no idea where this is going to go, but I'm sure I'll find out. So how you doing, my friends?
Pretty good. Yourself?
I've got a new computer.
Very happy.
The camera tells us all we need to know.
The camera looks amazing.
Yeah. It's this is first class, except I bought the model apparently with no speakers. But no, I know there's speakers on here, and maybe one of our smart listeners will text us or put something in the chat as to why my speakers would only work when I stuck the headphone.
So you're hearing through the speakers out of the computer right now, not your...
Do I look like I have headphones in?
This is crazy.
And watch. Well, I mean, you can't really hear what I'm
really
hearing.
Hear it.
Hey, Jeff.
But if I pull the jack out, the little RCA, you guys are gone.
Are you in an echo chamber now?
Well, now it's working again.
Maybe it just needed... Never mind.
Yeah. Jeff, can I tell?
Sometimes you just got to put something in the hole. That's what I'm saying.
That's all I needed.
Jeff, can I tell a story about you?
Please.
Okay. So, Jeff, I'm going to start this story with, I hope that you can keep track of this computer, because I gotta tell a story, and it's my favorite Jeff story. But Jeff and I started really hanging out in about 2016, 2017. And the first story I heard about Jeff is from a good friend of ours, Dr. Mark Geisberger. And Mark Geisberger says, dude, I got to tell you a Jeff story. And Jeff's right there. Jeff's right there while we're telling the story. He's like, dude, we're in a car on the way to the airport. And Jeff goes, I forgot my computer. He's like, we're on the way to the airport. We're leaving town. And Mark goes, it's in your briefcase. And Jeff goes, well, I forgot that too. So anyway, this is always a funny story about Jeff, kind of the absent-minded professor. So fast forward, we're talking about this story, and we're at an event in Nashville, and we're on the rooftop of this building, right? And so the event's beautiful. And the next day, our wives meet for the first time. We go to lunch. We're having a glass of wine, coffee, whatever it was. And Jeff's wife, like it's nothing new, says, Jeff, have you called the place that we were at last night yet? And he's like, no, I'll do that in a minute. They open at 4 o'clock or whatever. And she's like, well, you kind of need to get a hold of them. And I said, what happened? And she goes, well, Jeff got back to the room last night and realized that he left his briefcase and computer at the top of the building that we were at last night. And I said, oh. And Jeff goes, it'll be fine. We'll get it before we leave town today. I'll be damned if Jeff didn't get it. But Jeff, please keep track of this computer and keep track of your briefcase. I'm going to ask you to get an air tag and please put it in both of them. Okay.
Yeah. You know what? I am going to do that. Thank you for that, Chad. I am going to invest in some air tags.
But that's one of the things that we love about you, Jeff. And the best is it's gotten to the point where Honey Badger don't care.
No.
Honey Badger, like,
I know that stresses Chad out to no end, but I also lose things at a rapid rate. I can't tell you how many times I've had to rescue my phone from an Uber, and it has cost me a lot of money once to get it back from the Uber, having to track it on other people's phones to see if they can find my phone's location. And anyway, I can't judge you. I've lost more credit cards and phones than I think my husband would like to acknowledge. So
I've been really good at leaving credit cards at restaurants lately.
That's not hard to do. That's easy.
Yeah. I've done that 2 or 3 times within the past 6 months. That's very unusual for me, but I'm usually, so in tune to the bill and you just forget to pull your credit card out. But I'm a fan of the restaurants that come around with the little clicker thing. Tap it.
So here's what I do in restaurants. I'm good at getting my credit card back. And I don't know that it matters as much anymore, but I'm the guy that always does like the tip and signs the sheet and then takes that receipt instead of the one that was meant for me that you didn't fill all that stuff out.
Right.
That's my MO.
Okay. So here's one for you all. Do you all use Apple Pay?
Yeah.
Somewhat. Yeah.
Okay. So my kids use it all the time. As a matter of fact, my daughter is really good at it at college.
I bet.
So last week we were on the beach and I asked, we rented a kayak for an hour, which by the way, as a 51-year-old man, I do not recommend because I hurt in places that I didn't even know existed on my body after we did that. So I tell Ava's boyfriend, I was like, hey, let's rent a kayak. I was like, and he's like, which I should have never said. And he goes, okay. So he goes over there and he's like, I go, hey, just go figure out how much it is. And he comes back and he goes, I love this kid, but he goes, it's $350 an hour. I go, $350 an hour to rent a kayak? And he's like,
kayak?
He goes, no, $3.50. I go, Caden, that's not right. So we walk over there. And
neither of those scenarios make sense.
No,
350 is too low. 350 is too high.
So we go over there, and of course, I read the sign. And God bless him, he does go to the University of Oklahoma. I don't know what they teach children there, but when I read the sign, it said $35 an hour. And Austin's probably laughing right now because he knows this kid, and we love him, but he's a little bit out there sometimes. Yeah. So I'm like, Caden, it's $35 an hour, not
decimal points at Oklahoma.
Yeah, not $3.50, and it's clearly stated on the sign. I was like, let's get a kayak. And I was like, crap, I don't have my wallet. So the guy comes out and I was like, man, do you take this Apple Pay thing? And kid's like 21. He's like, yeah. I'm like, all right, so here's my phone. I go, can you help me figure out how to do this?
Oh my gosh.
He's like,
I'm mortified.
He's like, yeah. And I go, dude, old people don't know how to use this stuff. And he goes, I really don't either. I've just watched enough people do it that I figured out how to do it. I'm like, okay, cool. Yeah, whatever. So I was amazed by this. This Apple Pay is amazing.
I use it all the time.
More and more, I am using it now. Yep.
Because I can't find any of my credit cards.
Exactly, Davey.
If I'm being really honest, which you'll also note is why I do not carry a wallet on my phone because there's too much liability. They have to be apart from each other.
Me to the punch on that one.
Yes, I would agree. I would agree.
Funny. All right. Well, nothing about dentistry, but hopefully you've all learned your lessons about watching your shizzle.
Yeah. Watching your shizzle and do not kayak at the age of 50 plus.
51. Two really good takeaways there.
All right. I think we need to do some news.
Let's do some news.
I would love to. Chad, are you going to do some news today too, or?
Sure, I will.
Okay, well, I'll do
Right.
boring dental news first, and you can do new news.
Okay.
Got that, Austin? You got the order of operations here? Okay, team. I hate to come back on here and talk about Colorado, but we knew it was going to happen. Everybody was getting very pumped about the fact that we might be getting a breakthrough on this whole Colorado thing, but you knew it wasn't going to happen, right? You knew that. As soon as I saw that the DSO conglomerate and the organization had filed a lawsuit against them and started moving forward with that, I knew we were going to have a problem. And they had an emergency meeting and have actively paused a lot of the language that had to do with dentists owning DSOs, et cetera. So if you were startled or concerned about that information, fear not, children. Nothing is going to change anytime soon. If you are excited about the changes, sorry to tell you that the positive movement does not look like it's going to happen. If you were upset about the new laws that were being put into effect, guess what? You probably are going to be very happy about the long-term outcome. The jury is still out. They will now have to go through a formal process of review, but at least for now, they've paused the change in Colorado, and DSOs and dentists working in DSOs and non-dental owned entities, et cetera, can continue going on business as usual. Another very interesting update coming out of Nevada. Now, I think this is very important one to watch. So we've seen a lot of activity over the last couple of months with different states continuing to try to address workforce issues, and they are getting creative. And we've seen actually a lot of banter in the comment section for and against, and a lot of skin in the game about whether or not states are doing the right thing. In fairness, a consistent comment that I see on every dental forum that I'm a member of and follow is something needs to be done. Now, once something is done, everybody disagrees with the final idea, but at least something is happening. And so Nevada is kind of joining this new team of states that are looking at a kind of a mid-level oral preventative therapist that will focus on supragingival scaling and doing more of the hygiene duties, not treating periodontally compromised patients. This is for very specifically Nevada. This is to address the fact that they are down 20% in their dental hygiene workforce since 2020, and they've maintained a steady dentist workforce and a slight increase actually year over year since 2020. So you've got the same number of dentists in the private sector, if not a little bit more, and a decrease of about 20% dental hygiene. Something has to give, and Nevada is joining many other states like Missouri. Let's see, we've got quite a few other states. Hold on, sorry. Virginia also has some language out there that they're proposing as well moving forward. Arizona as well. And Illinois. So we've got several states that are out there trying to move forward with different language for this oral preventive therapist to try to fill the gap between a dental assistant and a dental hygienist. Now, a lot of critiques or critics of the bill have made comments about whether or not this is a good idea, and also will these individuals be well trained, et cetera. The ADA is actually coming out in support of Nevada and this new proposed law change that would allow for these providers to be able to sort of fill the gap between dental hygiene and dental assisting. Basically saying that it is a well thought out program. It has a lot of training steps and a lot of requirements in order to achieve this, which will allow the dental hygiene program and the dental hygienist in the state to focus on periodontal therapy. I don't know what the right answer is. I hope in the comment section you'll provide me some feedback, because at least they're doing something right, I think has been the adage. Like, we've been at a bit of a stalemate between dental assistants, dental hygienists, and dentists for quite some time about how to move forward to solve a very real problem which is workforce issues. We've got an increased number of dentists hitting the marketplace with all of these new dentists graduating from different programs. Year over year, I think we're over 1,500 more dentists graduating from dental programs than we were getting even just a few years ago. That's a big number. While the number of dental hygienists hitting the market today has precipitously gone down in almost every state. So states are getting creative. If you don't like it, be a part of the process and make sure that you're being active in the ADA, AGD, the Dental Hygiene Association, whoever else has skin in the game, because things are changing and I'm here to watch it all. The last little bit of news for the week. Florida. First off, so sorry. Totally misquoted something last week when I said he owed $100 million in personal income taxes. It was actually just 1.08 million in personal income taxes. So let me get the story straight. But we also had a dental admin person from still $63,000 from their dental practice. So just a continual reminder, we've had a couple embezzlement stories come out over the last couple of weeks and months and years. We've even had multiple embezzlement specialists on the program year after year talking about tightening up our review processes. Maybe other people on the show also know exactly what we're talking about with reviewing our financial paperwork. Just another friendly reminder that even the people who you hold close and dear, who might be working in your dental office, might be ripping you off. And with that, that's the news.
That is fantastic.
I've never had anybody rip me off.
No,
I know that about you.
never,
Never.
never,
Never.
never.
Nope. Not one time.
Mm-mm.
Nope.
I love the stories about embezzlement because it's just so vast in our
Oh, yeah.
industry. Because, I've always said this. We're back there flipping the burgers.
I know.
It's hard to be the CFO and the cashier and the bookkeeper and all of these things and be the burger flipper. It's
Correct.
almost impossible to do. And so we leave ourselves wide open by building a little bit of trust.
Because at the end of the day, that is how a business is run. Like, you have to have people who can do their job and do it well.
You gotta have people,
Yeah.
but you've gotta have built-in accountability.
I know.
And the problem is when you let it go for a little while before you implement it, now that accountability seems like distrust. Like now putting those parameters in and say, oh, wait, we need to stop. We need to look at this. Then all of a sudden, those people that you've been letting run free are like, well, what is it? You don't trust me anymore? Well, no, I was just too freaking dumb to be doing this in the first place. And I had to learn the hard way through one of my friends or colleagues or things like that. So I was going to really write an ugly comment about you getting that number wrong, JB.
You should have. I mean,
Yeah.
100 million did not make any sense. But I will say, in the story that I was reading, it was just it was written very strangely as no $sign 1.08 million. So it's just it actually wrote million out as opposed to it being an actual dollar figure. It was kind of clunky, and so when I went to read it, I totally butchered it. That's what proves this is live. 100%.
Yeah. And that we are consummate professionals.
100% also.
Well, except for Chad.
Yeah, except for me.
Well, we got a great guest, and I want to tie this whole thing together. I want to know what ranching, real estate, and dentistry have to do with each other.
Can I introduce our guest?
Please do.
Would be awesome.
Okay, and I'll tell my story at the end of the show. How's
No
that?
worries.
Okay. So, we were talking last week, and it kind of seems that there's a common theme that we really reconnect with people over continuing education, which is one of the best ways to connect with people. But when I was in dental school, we had upperclassmen that you just really, really look up to. And there was this guy that just walked around with a smile on his face all the time. And that is our guest tonight. And it is B. Octavio Elizondo. However, I am just going to lovingly refer to him as Ocho because that's all I really knew him as. And so last year, 2 years ago, we were in Nashville together and we ran into each other. And it was just like we never skipped a beat. We had a good time, you know, and of course at CE, you talk about other people and what they're doing and how life's going for other people and you catch up and reminisce on friends and foes and all that stuff. But man, we just had a great time. And so anyways, Dr. Elizondo practices in Harlingen, Texas, which, like, if you take Texas and you look, you got the panhandle up here. Harlingen's like way, way, way down here. It's by South Padre. So there are some pictures of him on the internet with a male G-string. I am not going to share those tonight, but he does frequent the beach. No, I'm kidding. But one of the one of the many things that amazes me about Ocho is, first of all, his biggest problem in life is that he went to the school that's on his shirt. And I went to the other school. They did not have an Earl Campbell, and we did have an Earl Campbell, the Tyler Rose.
Wait,
and as a matter of fact, there was a game last year right after Thanksgiving, and it was the first time Texas has played A&M in like 12 years. And I can't really zone in on who won that game, but I want to say that it was Texas. Just going to go out there and say that. A&M had a great run last year, and it won't happen again this year. But anyways, Ocho
Octavio, if you want to leave this show now, you can.
I know.
It's fine. It's fine.
I just let him talk.
Yeah, I know. So do we.
The Corps of Cadets at A&M, which, all kidding aside, is a huge accomplishment. It is a big deal to go to A&M. It's a great school. It is a bigger deal to go to A&M and be in the Corps of Cadets. Very, very serious commitment for all 4 years. Following that, he went to dental school at San Antonio, graduated in 1998. I graduated in 1999. Sorry, I'm aging us, brother. Over the past several years, you know, you look at the accomplishments of dentists. I have an FAGD, a fellowship in the Academy of General Dentistry, which is about 6% or less of the dentists. JB, Jeff, your master's, right?
I am not. I am a fellow. I have enough credits for a master's. I just never put my shizzle.
Never did the paperwork.
So JB has a master's, but Ocho also has a master's, which means that is less than 2% of the dentists in the United States, which is a pretty damn astounding accomplishment. He has over 1,700 hours of continuing education. He's a member of several societies within dentistry, obviously the AGD being one of them. But where I met him was at the International College of Dentists, which I'm just going to say he deserves this because the International College of Dentists is about people who give back, and he gives back. But what has amazed me over the years is I watch this guy. He's an incredible dentist. His lunches that he posts pictures of on Facebook, like, will make your mouth water. The guy goes and eats like at these crazy places in Harlingen.
I'm going to send him a friend request right now.
This Mexican food and stuff that he eats, like, I don't know how he keeps his figure, but holy crap, the stuff looks amazing. He raises Brahman and what was the other breed of cattle? Brahman and
Red Brangus.
Red Brangus. Beautiful cattle. I mean, dude, this cattle that he raised, it's just absolutely beautiful. he breeds German shepherds. I don't know if that's intended or not, but
No.
he had a German shepherd that had a gorgeous litter of puppies. And then the guy decides, like, within the past year, oh, I'm gonna go get a freaking real estate license. And so you're like, oh, he's giving up on dentistry. Oh, hell no, he's not. This guy is truly a jack of all trades. He's a Texan, he's a friend, and we have a lot in common besides the college thing. But I'm telling you, I'd go. He went to a great school. I'll give him that. But Ocho, man, it's so good to see you, dude. You're such a
Likewise.
wealth of knowledge in dentistry, and we're so honored to have you on the show. And we're just going to talk tonight. So I'm going to open it up to JB and Jeff and let y'all start off with questions. But glad to have you here.
Ocho,
Thank you.
So good to be with you, dude. Do you have an Emmy too, or an Oscar? Is that what that is behind you?
No. I think it's my brother gifted me a doll from Japan.
Okay, all right. Okay. I didn't know it. I mean, why not throw acting into the mix? Is all I'm saying. But is it me, or if I had a little more Latino in my blood, could we not be related a little bit?
You could be a little related.
Yeah.
He's a lot nicer than you, though, Jeff. Like, he's very nice.
It's a given.
Yeah, he's very nice.
Well, great to have you with us. So,
thank you.
Yeah, so I want to. So you were the upperclassman to Chad. Did you want to kick him in the teeth the first time you met him?
No. He was a great guy. I remember actually when I was the Dental Student Association president my senior year, my fourth year. And I don't know if you remember this, Chad, that I actually went over to your office, your cubicle, and was encouraging you to run for DSA president because I thought you were a great guy, and I thought that the Dental School Association would benefit from having someone like yourself as the president. But then you didn't run. Somebody else ran, and you decided you didn't want to run for president. So, but anyway, it's just I remember him very fondly.
He's still practicing in that cubicle.
Yeah.
They haven't let me out. They haven't let me out yet. So
but I remember that clearly, going over and seeing you to say, "Hey, Chad, I think you should run for president."
Well, I appreciate that, but politics has never been my thing. I've got too many skeletons in my closet, man.
Even for dental school, dental association president, like,
how
ruthless is it in Texas?
It's ruthless.
Let's start with the ranching thing. Like, so
maybe
Dr.
we just do a
Elizondo,
journey.
Yeah, congratulations, Dr. Elizondo. You've got your Doctor of Dental Medicine or Doctor of Dental Surgery, whichever that is. So what are you going to do next? I'm getting into ranching. Or what happened? What was the progression of what happened there?
Yeah, tell us about your journey after dental school.
Yeah, I graduated from dental school, and I moved back home to Harlingen area, and I just decided I've always worked with cattle and ranches and things like that, and so that was my plan. When I went to A&M, my plan was to go to vet school, but every person that I spoke to when I first started at A&M, they said, "Oh, no, you're not gonna make it. That's a really hard major. You're gonna fail." And so I kind of just was really good at math, so I was an accounting major for 2 years at A&M. And then I said, "I'm not happy doing this. I want to be a veterinarian." So I went and I switched majors into biomedical science. And as I was doing that, I was gung-ho, I'm going to go to vet school. So I've always had a love for large animals, cattle, horses, things like that. Well, one of the required classes was to listen to different professions. It was like an introductory course. So I go to this class to sit there and listen to a dentist. And the dentist that came to talk to us was Dr. Joseph Barong.
Oh, dude.
Oh, man. I fell in love with Dr. Barong as a person, just an absolutely wonderful man. And to this day, I love him to death. And I went up there and I said, "I think I want to do what you do." And he said, and I was in my uniform in the Corps and stuff. And so he always tells me, you stood out because you were in your uniform. And there's not a lot of us at A&M that were in the Corps. There was maybe like 1,600 Corps members in the whole school. And so we stayed in contact, and I applied to dental school. And I remember I only had one interview, and it was with Dr. Carr. And I saw all the other students had 2 interviews. I only had one. And I went in, and I remember Dr. Carr telling me, he's like, I just wanted to meet you. Dr. Barong spoke very, very highly of you. And I want you to know that you're coming to dental school here. And so I went to dental school. And I still stay in contact with Dr. Carr and Dr. Barong. And Dr. Barong just really, really believed in me. And he always tells me, just the fact that you were in the Corps and you had good grades, I knew you were going to be okay. Mm-hmm. And so that's how I became a dentist. I wanted to be a vet.
Dude, okay, so I'm going to take a little sidestep here because I want to let these two know, and this is a great segue for anybody trying to get into dental school. I think this is wonderful. Dr. Barong is one of the best people I've ever met in my life, and I've got to tell you both a story. You both have met my dear friend Dr. Gary White, who's been on our show. So, somebody was asking just a minute ago on Facebook about their child that was trying to get into dental school, and Dr. Barong loves Aggies, but he also loves Longhorns. He went to Southwest Texas State, which has no enemies. Yeah. But anyways, Dr. White, my good friend who's been on the show, had applied to dental school. It was his 3rd time applying, and he had just kind of given up. He was like, you know what? I'm going to go to University of North Texas, and I'm going to get a master's in public health, and I'm going to still apply to dental school. But if I don't get in, I'm just going to do this. So anyways, Dr. White graduated from college, is moving into University of North Texas. And this is my 3rd year in dental school. And he knew that Gary and I grew up together. And Dr. Barong calls me out of class the first week of school and says, Duplantis to Barong's office. And he was an associate dean. Yeah. So of course you go racing in there and you're like, oh my God, what did I do? I mean, I'm in trouble or whatever. And I walk in there and he goes, the squeaky wheel gets the grease. And I said, yes, sir. And he goes, Dr. White has been to this school, or he goes, Gary White has been to the school several times. And he goes, he really wants to be a dentist. And he goes, and he's on the waiting list for this year's class. And I go, well, school already started, sir. And he goes, it did, but we have a dropout today. And he goes, and I remember Dr. White really wants to go to school here. He goes, do you think he can be here tomorrow? And I said, I think he might be able to. So my parents and Gary's parents were best friends. He goes, what's his phone number? I go, he doesn't have a cell phone. I mean, this is 2001. And he goes, you have his dad's number? And I go, let me call my dad. And he goes, all right. And so he goes, give me the number. So I give him the number and I go, hey, can I do something? And he goes, yeah. And I go, can I let him know he got into dental school? And he goes, yeah, but give the phone to me right afterwards. So we called Gary and I get his dad on the phone. His dad's sweating. And I said, hey, what's going on? And he goes, man, we're just moving a bunch of crap into Denton. We're trying to get Gary situated. I said, take everything you put in the apartment out. And he goes, what do you mean? And I go, I got somebody you need to talk to. I hand the phone to Dr. Barong and he goes, hey, Gary, can you be in class tomorrow morning at 8:00? And Gary goes, yes, sir. And that's the type of person, and that's what dentistry needs. And Gary moved everything out of the apartment, had no idea where he was going to live, came down. We found him a place right across the parking lot from me. But that's what dentistry needs, is more of Dr. Barong. And I'm glad you had a great experience with him too, because I still keep in touch with him. Just a wonderful human being that he epitomizes what dentistry should be.
And he epitomizes what a person should be.
Absolutely. Absolutely.
In everything he does. He's just top-notch individual.
He is, man.
So that's how I ended up in dental school. And I got out. I still had my love for animals. And so I went and I bought some acreage, and I started buying more acreage and more acreage. And I started saying, well, I can't just have land. So
you got to put some cows on it.
I got to put some cows on it, And so I put cows, and then I looked over and I had my 2 daughters who were 8 and 7, And I said, well, they're old enough to show animals in the stock show. So I made some corrals and started just breaking cattle, and I would train them to where they were just the most gentle, docile animals, because my daughters were going to show them,
Yeah.
and so
Mhm.
my daughters still remember, 8 years old, walking in, tiny little girl, walking in with like a 2,700-pound bull, and walking the bull around the arena like if it was a little puppy dog, and winning reserve, and grand champion and things like that. And people would, like, you could hear them gasp when my daughters would walk in with the show animals. And so those are just excellent memories that I have of doing the cattle stuff. And I kept breeding and breeding, and I took a lot of classes at A&M for reproduction and stuff for cattle, and so I artificially inseminated my own cattle and did all that work. So everything that I had at my ranch was all my creations that I was putting together with genetics, and I mean, it was absolutely a great time. It was just a very difficult time as well. Just it's a lot of work.
It's a lot of work. How do you
So
okay, what were you in private practice, or what was clinical dentistry like for you as you were kind of going through? Because I know the life of a rancher, 2 a.m., you're caffing or whatever,
I
like,
am.
right? So
Yeah.
what does that look like in you're doing clinical dentistry?
And and this is all, I know it's hard to believe, but it's all true. I have friends that always tell me, I don't know how you did it, but I worked public health. And so one of the best things I ever did out of dental school was work in public health.
Mhm.
But one of the worst things I did was work in
Work in
public health
public
for
health.
too long. Okay. So I
Okay,
should have
fair.
stayed for the first 3 to 4 years and had my loans repaid, and then and I had a private practice during that time. So I was practicing into the evening. I mean, I wouldn't go home till 9 o'clock at night. So I didn't start the cattle stuff until later on. I mean, at the very beginning, the first 4 or 5 years, I bought land and stuff, but I
Yeah.
didn't have cattle. Um, and so I stayed in public health almost 10 years. And so I think that was kind of like a detriment to my career. But then once I finally left and started working full time, um, I kind of felt like, man, I'm not doing, I don't feel satisfied. I don't feel fulfilled professionally. So I joined the AGD. And again, it's always about who you run into,
Yep.
because Chad, I mean, I don't know if you know Dr. Brad Williams, but he's a
Yeah.
instructor. He's an instructor with the American Orthodontic Society. And so I have my cattle, and so I have my cattle. I'm working my cattle, and a devastating thing happens to me. And I can talk about it now, but used to talk about it, it almost ended my career. I would get very emotional about it, but now I look at it as like, it really did change my life, because I got a bull decided to act up and
Mhm.
completely shattered my hand. So I didn't practice dentistry for about 6 months. I had surgery. My whole right hand is all pins and wires and plates and all that. And I had a fantastic surgeon, and then I had an even more fantastic therapist who brought me back. And so luckily the dexterity was here and the strength is here. And so the strength is what got broken, but the dexterity stayed. So I
Mm.
was able to actually pick back up, and I started practicing again. But in that time, I said, well, what am I going to do? Like, Chad, what do I do? I'm not going to practice anymore. And I ran into a friend of mine, and he said, take some ortho classes. So that was on a Saturday. I go Monday to my office, and I call the AOS, and they said, well, we have a class that starts in October. Well, this is in May. And I said, well, I don't want to wait till then. He goes, well, in a couple of days, we start our classes in Orlando. And so I said, sign me up. And so I flew to Orlando, 5 sessions for 5 months, and I took the classes. Well, the instructor was Brad Williams, and he just knew exactly what I needed as far as professionally, like that lighting that fire. And the first thing he did was tell me, join the AGD, and work to get your fellowship and your mastership. And I did. And I went and got my fellowship and I got my mastership. And then I got 3 lifelong learning and service recognition awards, one after another, just busting myself, just working hard, trying to get them done. But I got like hooked on it. I wanted to learn. And so I did all these courses, all these master track programs. I met the most amazing people. And, you meet the most amazing instructors, and then you
Yep.
meet the most amazing other dentists that are also there as students learning with you. And I love dentistry. I love, ranching and land and real estate. And that's how all that came about. And it was just meeting the right people because of sometimes bad circumstances, like I thought my career was over with that fractured hand.
There's such a beautiful lesson, kind of what you were talking about, Chad, too, with Gary. Like, we all have desires and things. Octavio, you went to school thinking you want to be a vet, and life kind of led you in a different direction with different exposures or whatever. Some might reflect on that as a disappointment or a lost opportunity or whatever. But I look at your life now and it's like this beautiful marriage of still doing the thing you love with animals, but also this newfound love and skill in something that maybe had never really been on your radar before. So it's kind of the same with Gary. Like it was all in a timing in which we don't always understand, but it sort of manifests itself in very unique and special ways. So I think it's kind of beautiful. I keep thinking maybe you need to go back to vet school now, because we had a
Full circle.
dental vet on here, and that is really, really fascinating. They're doing CEREC crowns and all kinds of cool stuff. So
Yeah.
You know what though? I want to say this. I mean, I don't know how prevalent this was. I know probably for Jeff. I don't know about you for JB, since you were a few years after us. But one of the things that really irritated me was that I wanted to be a dentist since I was 14. And so when I got to dental school and I found out that there were people there that were at dental school because they couldn't get into medical school, that really pissed me off. And the thing is like when Ocho started that story and he's like, I wanted to go to vet school. But there was a pivot that made
that's what
him
I love.
change
Yeah.
and realize he wanted to go to dental school. That's what we need right there.
Yeah.
And Ocho, did you have those people in your class that were like, oh, well, I'm in dental school because I couldn't get into medical school?
Yeah. Oh yeah, absolutely. There was
And I
probably
guarantee we
4 or
won't,
5 of
but
them.
I know we could name them, and they're the
Oh
same
yeah.
people.
Oh yeah, no, I know.
I
And
actually, like, I think by the time I went to dental school, which was clearly decades later, it's
Days.
not actually, it was like 3 years. Anyway, I will say by the time I went to dental school, there were, like, at UNC, 1,000 applications for 80 spots. Like, it had actually become incredibly competitive, and I don't know if it was harder or easier to get into med school, but it definitely had become very highly sought after, and it seemed much more competitive than I think it used to be. So I do think it had evolved at that point, maybe. But what I love is that you went to you had a curriculum in a class that showed you all the different
Mhm.
career options, because I think we only know what we've been exposed to. I mean, you only knew vet because you loved animals, and that was kind of this natural thing. Same for me. I only wanted to go to med school because I didn't even think about dentistry. And then my dentist told me that I wanted to go to dental school, and I was like,
Yeah.
no, I don't think I want to do that. And he goes, no, you should. And you just come work for me this summer. And that changed my whole life trajectory. So
Yeah. It's just amazing how that works.
yeah.
I can tell you I thank God every day and every time I remember, for meeting Dr. Baran. I mean
Yeah.
that he and then I always remember, and I always thank God for meeting Dr. Williams, it's like there's people that just absolutely
Absolutely.
stand out because they just have such a pivotal impact in your life. And that's what those gentlemen did for me.
I think there's something to be said too about
Oh, hey,
being
Jeff.
able to kind of roll with the punches. What's that?
I said, oh, hey, Jeff.
Oh, hey.
We'll let you
to
talk
be,
now.
good to be around the table. Thanks.
Yeah.
No, I think there's always something to be said. Also, I think the people that we come into contact like that, and like you know, I went to undergraduate at the University of Pittsburgh, knowing that or thinking that I wanted to go to dental school, but it was meeting Francis Miklos up at the dental school up there, who is the dean, who is just this really inspirational guy. That, one of those kind of people. I think there was a time where a lot of the deans of admissions were, that kind of
Yeah.
inspirational, let me find the best people for this role kind of person. And that's what solidified it for me. Then I knew I wanted to go to dental school. But I think as important as some of these incredible people that we meet, I think one of the inherent qualities that I see over and over in successful people is that ability to accept that something got in the way of what I originally planned.
Mhm.
And even though it may seem devastating, let me roll with this for a minute. Let
Mhm.
me take this in, and to have the ability to pivot and try something new, or at least open your mind to something new, and not just see the fact that, well, what I wanted didn't work out, I'm a failure, or the world is against me. I really think that in every successful story that I see, and all the successful people that we've interviewed, that seems to be the common trait, that they had someone amazing in their life that opened the door to something new, but also that that person was willing to accept something new, and
Mhm.
to open their mind into a different direction than what they had originally thought they wanted.
Yeah.
Yeah, great story.
All right, let's talk about education, because I think
100%.
there's a lot of obviously lots of options out there, lots of opportunities. Um, Talk to me about what education has meant for you as a clinician, both from a clinical perspective, but also just personally, and the impact that it's had. And if there are particular, like, I know you've talked about Master Track, which I think are some of the best courses out there. I think
Mhm.
phenomenal people who attend, phenomenal people who teach. One of my favorite Master Track programs that I took was taught by my dear friend Jeff Horowitz. So,
Mhm.
like, there's some amazing clinicians out there
Who?
that are teaching. Uh,
Who was that, JB?
I'm sorry, I said Turby Phil. That's what I said.
Oh,
Yeah, yeah. I meant to say Turby Phil. That's actually what I meant to say.
I,
Anyway,
I, I loved his.
yeah, they were actually really good. But anyway, I think it's an interesting topic because newer grads coming out today have a significant amount of debt that they've already paid towards this education, which we had a very different perspective, I think, on that. And certainly our debt load was very different at the time. Um, and the reality is there's still so much that they don't know or get in dental
Yeah.
school. So talk to me a little bit about your educational journey, the value proposition.
Yeah.
Sell
And
me on education.
well, let me tell you, and I'm big, big, big on education. I'm working on my fourth LLSR, as just always taking
There's
classes.
not that many. I mean, you talked about 2% MAGD. He's probably now
would
in the
you
0.005%.
would you pause and tell us what LLSR is?
Mm.
It's an award that you can get through the Academy of General Dentistry. Um, Once you finish your master track and you get your mastership, you get your MAGD. Um, it follows it, and it's an award that you get by providing a certain amount of hours of pro bono work, giving to dentistry, functioning in directorship positions, in an organized dentistry. You have to take 150 hours of hands-on courses and another 350 hours of courses, just regular lecture courses. And so, um, they're very hard to come by. You know, they require a lot of work. It's not just CE. You actually have to give back to your community.
Yep.
And there's a group here in the Rio Grande Valley that I work with. It's the Dentists Who Care, and so they do a lot of functions down here to try to like help the needy children, mainly like children. And so I'll donate a lot of my services to them. Um, you just have to work really hard at just giving to your community, giving to organized dentistry, and then doing the courses. And so when I was in one of the master track programs in Florida, I met Dr. Tony Menendez, and he's from Florida. Coral Gables, I believe, is the city. But anyway, he was one of the instructors there and one of the mentors there, and he had six, and so he had five, and he was working on six. And I said, I'm getting my third one, and I hope to one day catch you, catch up to you. And he says, I hope you do. And so when I was getting my third, he was getting his sixth. And I said, well,
You're like,
you're making
"Damn
it
it,
really
Tony."
difficult for me, so I'll just keep working on that. And he
Tony,
tells
calm
me,
down there.
yeah. And then he tells me, well, there's the guy somewhere in the East Coast that has 8, and I'm trying to catch up to him. And I
is
said, oh,
that?
forget it. I'll be working
Who
on it for a
I
long
gotta
time.
know. I'm gonna have to look this up. I gotta know who the guy is with 8 LLSRs.
Yeah, he tells me there's this
We got to
guy,
get
he
him
has
on
8.
actually.
Yeah, 8 LLSRs. So
Carol
anyway, for
Wooden
me, it's just one of
has
those. They bring me
several.
satisfaction to do them. I enjoy the fact that I'm able to give back to my community here, and so I enjoy that. But like I don't want to like upset anybody or any groups or anything like that. But I can tell you that if I was gonna, and I do when I speak to dentists and dental students that are coming out, that are young dentists here in the area, and they ask me like, hey, how can I get the most bang for my buck?
Mm-hmm.
And I tell them, I mean, you can be a member of a lot of associations out there, a lot of organizations out there, but all you have to do is pay money and you're a member. And to me, that doesn't bring anything to me. Like, I don't want to pay money to say that I'm a member of something. I want to be a part of a group that is actually making me a better dentist.
Yep.
And in my opinion, the Academy of General Dentistry is the way to go. And they're not paying me to say this. I've been a member, and ever since I became a member and I started doing their courses and doing their fellowship, their master track programs, and continuing on to doing their LLSR programs, I feel like I have really, really mastered dentistry. I walk into a room and I place implants. I do all kinds of surgeries. I crown preps and things like that. And one of the best feelings is when I prep a tooth and there's a dentist in my office and they're looking at the mill that I use, or they're looking at the technology that I'm using, and they look and they're just like, how do you do that? Like, how do you keep your preps? Like, that's what we were having to do in dental school, but like, we don't do that once you get out, and so I hear their comments and I was like, well, you should be,
Yeah.
you shouldn't be, doing substandard dentistry, but that happens. And so I feel that doing the Academy of General Dentistry programs really did level me up so much more than what I would have been if I had not done it, and just the knowledge that you just gain from the classes, the people in the classes, doing your presentations. I mean, you just don't show up, you have to go back home and you have to go to your office, you have to develop a protocol. You have to go in and do a lecture presentation in front of all the master track, programmers,
Mm-hmm.
the what do they call them? I guess the people that are
Proctors
in
or
charge, the
yeah.
monitors, the proctors,
Yeah.
but they actually sit there, and all the other doctors that are in the classes, the other dentists there, they sit and watch your lecture and ask you questions, and it's the most nerve-wracking thing you've ever do, because they're looking at your work. And it's just, to me, that's been the most return on my investment as far as becoming the best dentist that I can be.
Don't you think community is such a huge piece of that, though? I mean, we
Yes.
can all there's so many great courses, and there are great courses
Yeah.
online, and there are great, live streamed there's a lot out there, but there is so much more that comes from being in that community and being able to share experiences. Like everyone leaves a master track and then they go back and try it and they prepare for their presentation. And that's when everybody learns what all of the potential problems and side effects are.
Yes.
And then it's when you're sitting in that course and you have the opportunity to turn to the guy next to you, hey, did this happen to you? Did you have this issue? Because you don't feel alone. When you're by yourself, that kind of makes you feel like a failure and like, oh, I don't need to do that. When you hear other people are having the same issues and same concerns, it's validating. And you're not, that you're not alone, and you know that now, okay, this is something, how do we address this as a community and not me just trying to take on the world?
Yes, absolutely. And that's been my take on education, and I've never regretted it once. I went from just doing things just the way I used to do them from out of dental school, and next thing you know, I've got one of the most high tech offices in my area, and they come in, dentists will come into my office. It's like, you have that, you have this. What do you? How did you do this? How did you afford this? And it's like, well, I mean, I make payments just like anybody else. I just believe in the technology, and I believe in the just how it's made things so much more enjoyable. And I
I
just absolutely love going to practice every day.
I talk about that a fair amount because this is not financial advice by any stretch, because I don't want you buying things that then subsequently
Mhm.
make you go bankrupt because you've overinvested. But what you said is so valid. There is justification for buying things that keep you excited and interested in dentistry,
Mhm.
because it's hard and it wears on you, and the challenges that you encounter on a regular basis. If technology can come in and fix that for you and get you super excited again and not annoyed by the same thing over and over again.
Mhm.
um, I talk about that all the time. People want to know the ROI on digital investments, and I'm like, there's all the tangible things that you can see that help, but man, if it just gets you excited to show up every day and like keep cracking the
Yeah.
code and trying to get better, that's worth it right there, because you'll level up just because you're excited again, and there's an ROI right there.
Yeah,
Amen.
absolutely. And
Yes.
Chad, I had when Todd Ehrlich was lecturing and stuff, and he was getting into all the stuff with the milling and all that. I remember him calling me. He says, "Ocho, you got to get into this, man."
Yep. Yep.
And I did.
Hmm.
Do you
Yeah.
all remember Todd Ehrlich? He
Yeah.
passed
Great
away
Yeah.
guy.
from a
Yeah.
motorcycle accident
Yeah.
several years ago. Great guy. Yeah. So
Yeah.
he was
We both
he
went to
was a
A&M together.
Oh,
class.
really?
Damn
Yeah.
it. Yeah. Classmate of Ocho's at A&M and UT HSCSA. So
And let me tell you a funny story about him. I walked into dental school. I didn't know anything about him. I walked into dental school and we looked at each other and we're like, "What are you doing here?" And he used to work at the liquor store there by College Station by the university. And I would go in there to pick up like a little bottle or something. And so I would see him there all the time, and we'd talk and just, "Hey, how's it going?" And we recognized each other
That's funny.
in dental school our
That's
first
so
year,
funny.
but we
yeah.
didn't know each other back then at all. Like, I just thought he worked at a liquor store, and he just thought I was coming in just picking up liquor. And that's
And the
how
best part is he was Mormon.
yeah. And it's hilarious because he worked at a liquor store, and he remembered me, and
That's too
we were
funny.
next to each other, E and E, and we went through all dental school together.
You
It's
guys
funny
had a
how the
great
alphabet
class.
brings people together in dental school,
Yeah.
Yeah.
because that
Yeah.
mine was
Oh,
the exact same
Yeah.
way.
so
Uh,
does. So
yes.
does.
Yeah.
So does. Yeah.
All right,
Well,
guys, let's leave. I want to leave Octavio up here, but Jeff, you've got a little chew on this,
I do have a little chew on this. So,
and we can get his feedback. I'd love to hear what he
yeah,
has to say.
yeah, please give us your feedback, because we're trying to do some things that also get the public interested in not necessarily what we're doing, but in understanding about dentistry. So this whole little chew on this thing is just little tidbits to make the public think, and maybe think a little bit differently about why dentists are doing certain things or asking certain questions. So today's chew on this goes like this. Is grinding your teeth really just about stress? We've all been told we grind our teeth because we're too stressed out. Well, chew on this. Bruxism is way more complicated than that. Sleep bruxism is associated with sleep arousals and very often can coexist with sleep disordered breathing, sleep apnea, medications, and so many other factors. So before just asking your dentist to make an eye guard, why not ask, do you have any insights as to why I may be grinding my teeth? Because that can open the door to other areas that can absolutely improve your health.
Wow.
Yeah.
Was
I think that's
impressive.
so true.
Yeah.
A sleep test should be ordered.
100%.
Yes.
100% before we start making an eye guard, because we know that, if the patient does end up having sleep apnea, that night guards make more than 50% of those patients worse.
Yes.
So I think questions like that, going to dentists, finding dentists that are not just telling you what's wrong, but are asking the question, why did it go wrong in the first place? That's really, I think that marks a really great clinician versus a good clinician, is someone who's asking those questions.
Also,
Great talk.
function
Great topic.
and attrition is not always bruxism. Can
That's
we
right.
all agree on that?
Absolutely.
Just because there's wear patterns doesn't mean it's nocturnal
Perhaps
bruxism.
that's the next chew on this.
I see a number 2.
I see number 2.
A chew
Who
do.
does number 2 work for?
I just want to hang out with Ocho now forever.
I do too. I love
Chad,
Ocho.
you're out. Ocho's
Yeah.
in. That's the way it is.
I feel like he looks more like my brother than the brother I found out that I had.
That's actually
looked like my brother.
factually true. I saw your brother. Ocho looks way more like your brother than your brother.
Yeah, so you see, growing up, I always thought I was just Mexican American, and then I did that DNA test, and it turned out I was more Portuguese and Jewish than anything else.
He is your brother.
Elizondowitz.
I am actually.
Brothers
Absolutely.
don't shake.
Yep.
Brothers hug.
Oh my gosh. Is he your other long lost brother?
Could be.
Oh, we need to get Ocho to Chicago.
Yeah, that's a
Absolutely.
conversation for
Next
another
meeting.
day too. Also,
So, do you want me to close this out?
I would love for you to close
it out, Chad.
All right. Well, first off, Ocho, thank you so much, man. I mean, dude, your class was just full of great people. But you are everything that makes dentistry exciting. You love your passion for dentistry. You love your passion for things outside of dentistry. And we need to be well-rounded people. Your excitement and educational endeavors should excite everybody, but the moral of the story is just that if life throws you a curveball, find something that you can embrace. And from what I gather for you, it was this orthodontics. And even though that's not what you centered your practice on, it's what helped you get back into the game and kept you focused on dentistry. So thank you for everything that you do for dentistry. I know that this will not be the last we hear from you, and I know that there will be a lot of people that can benefit from your story. So thank you for that. As we close tonight, even though you are an Aggie, as we close tonight, I will say this. Yesterday was a tough day. I don't know if you all know this, but I had a deeply personal relationship with a woman that passed yesterday. I had a crush on Dolly Parton. I did.
I
Do
can't
you
blame
have her
her.
poster in your room?
I might have as a child, but Ellen knew that I had a thing for
she's
Dolly.
on the list.
She's on the list. She's on the list. But no, all kidding aside, if we look at who passed yesterday, I mean, there's a lot of people that come and go and whatnot. I don't think there's too many people out there that can say a bad thing about Dolly Parton.
There wasn't one.
I mean, she
yesterday.
was amazing. And today on the way to work, I listened to Islands in the Stream. And, when you look at Kenny and Dolly, that was truly a match made in heaven. I know that Dolly had Carl and Kenny had like 6 or 7 different people, but they could have been the ones for each other, right? But what Dolly gave us was an extraordinary amount through her lifetime. She gave us her music, her laughter, her movies, her faith, her philanthropy, but most importantly, she gave us her kindness. And this world could all benefit from Dolly's kindness. So I'm going to close with a request for everybody, and you got to do it today. So this is for the live watchers out there. Go to Google and Google Dolly Parton and thank me later, because it's a beautiful tribute to an amazing woman who gave so much to America. And there's so many things that we can learn from Dolly Parton. And all kidding aside, we all need to live our lives just a little bit more like Dolly. And in dentistry, we need to live our lives a little bit more like this guy over here, because he's pretty damn amazing. And I see that you too were like, yeah, this was a freaking great guest. And Ocho, I know you were a little shy and a little bit, I don't know what to expect. Dude, you've got everything that dentistry needs, man. We appreciate you and we thank you for being on our show. And we look forward to hearing more from you. So good night, everybody.
Well said.
Good night.
Good night.
Good night.